Do you frequently feel like your heart races, or you're unusually tired for no clear reason? Or maybe you've had a fever that just won't go away. These might seem like small issues, but they could point to something bigger, like your body fighting hard behind the scenes. Imagine your immune system as an army. When there's an attack like an infection, your body sends more soldier cells, called white blood cells, to defend you. Leukocytosis is simply the name for when you have too many of these white blood cells. It's not a disease itself, but a signal like a warning light on your car's dashboard telling you that something's going on inside your body that needs attention. So what causes this surge in white blood cells? Think of it like calling for backup. If you get a cut and it becomes infected, your body says send more troops and produces extra white blood cells. This is a natural response. Common causes include infections like a bad sore throat or pneumonia inflammation, such as from arthritis or even stress. Yes, emotional stress or a tough workout can temporarily raise white blood cell counts. Other causes include smoking medications, like steroids, allergic reactions, like after a bee sting, or more serious conditions like leukemia. For example, if someone smokes daily, their body treats smoke as an enemy, keeping their white blood cell count high. It's like keeping the army on constant alert, even when there's no real battle. Now here's the tricky part. Leukocytosis often doesn't cause its own symptoms. Instead, you feel the symptoms of what's causing it. Think of it like your phone buzzing. It's not the buzz that's the problem, it's the message. So if you're feeling weak, running a fever, coughing a lot, or have pain somewhere, those could be clues. Sometimes, if the white blood cell count is very high, you might feel dizzy or have trouble breathing, like a traffic jam in your blood vessels. Imagine your blood as highways. Too many white blood cells are like too many trucks on the road, slowing things down. Some people notice they bruise easily or feel bone pain, especially in the legs, because that's where the body makes these cells. The key question to ask yourself: have I been feeling off lately or fighting infections more than usual? How do doctors find out if you have leukocytosis? Simple: a blood test. It's like checking the number of soldiers on duty. A complete blood count test measures your white blood cell count. Normal is usually between 4,000 and 11,000 cells per microliter. If it's higher, the doctor looks for why. They'll ask about your health history, check for fever or swelling, and maybe do more tests like a blood smear or even a bone marrow test in rare cases. Treatment doesn't target the high count directly, it targets the cause. For example, if a bacterial infection is causing it, antibiotics will help. If it's due to stress or smoking, lifestyle changes are key. It's like fixing a leaky pipe. You don't just clean the floor, you fix the source. If leukemia is found, treatment may include chemotherapy or other advanced care. The good news: in most cases, once the cause is treated, the white blood cell count returns to normal. Not directly, but you can reduce your chances by staying healthy overall. Think of it like car maintenance. Regular checkups keep everything running smoothly. Stop smoking, manage stress, try walking, music, or talking with friends, get enough sleep, and eat a balanced diet rich in fruits and vegetables. Wash your hands to avoid infections, like before eating or after being out in public. If you have a long-term illness like diabetes or arthritis, follow your doctor's plan. For example, a student who pulls all-nighters and eats junk food might get sick more often, raising their white blood cell count. But with better habits, their body won't be in constant defense mode. Prevention isn't about being perfect, it's about making small, smart choices daily. Recent research is helping us understand leukocytosis better. Scientists are learning that long-term high white blood cell counts, even without infection, can signal higher risks for heart disease. Imagine your blood vessels being irritated over time by too many active immune cells. New tools like AI-powered blood analyzers can now detect tiny changes in white blood cells earlier than before. Some studies are testing drugs that calm overactive immune responses in non-cancer cases. Also, research shows that lifestyle changes like exercise and plant-based diets can lower chronic inflammation and in turn reduce leukocytosis. For example, a 2023 study found that people who walked 30 minutes a day had lower white blood cell counts over time. The future, more personalized care using your blood data to predict and prevent issues before they grow.